Hello, my name is Arlene Rodriguez, and I'm going to be presenting on a 9-year-old child that presented to the clinic with his mother. His chief complaint was bumps in the skin in several parts of the body. The mother states that the lesion started a few weeks ago in the leg, and now they have spreaded in the armpits and in the abdomen. She's also concerned because her younger child, or the little sister, also has these bumps. So for my review of systems, the 9-year-old child is alert and responsive. The mother denies any fever, any sleep disturbance, or loss of appetite. There's no swelling. The mother denies any swelling in the arms or legs or hands and feet. No chest pain, dizziness, or shortness of breath. The mother also denies any cough, wheezing. And again, she does admit to the rash that is present in the abdomen and armpits and legs. And the mother states that sometimes she sees the 9-year-old scratch, so the bumps are itchy at times, but the bumps are not painful. The 9-year-old's past medical history is positive for obesity, and he also did have COVID last year in 2001. Mother denies any past surgical history, and he is up to date on all his immunizations, including COVID and influenza. The mother states that there is a family history of diabetes and hypertension on the maternal side and hypertension on the paternal side. For his diet, the 9-year-old is trying to eat less sugary drinks, and he's also trying to eat less chips and fatty foods since his last visit. No known drug allergies. He is not currently taking any medications. On my physical exam findings, the child is well developed, well nourished, no acute distress. His heart sounds regular rate and rhythm, S1 and S2, no murmurs. His lungs were clear to auscultation bilaterally. Respiratory rate is normal. And let's see. And for his skin, I did see small raised white and pink or flesh-colored lesions or papules with a small dimple in the middle. So my assessment is that the child has Musculum Contagiosum, and my two differential diagnoses are keratosis pilaris and also basal cell carcinoma. For my plan for this child is that usually Musculum Contagiosum, it clears on its own around 6 to 18 months. So for children, they do not really recommend treating it, just kind of letting it clear on its own. It is a virus. And just some anticipatory guidance that I would give the mother is to encourage the child not to scratch or pick at the bumps or the papules, because this will actually cause the infection to spread to other parts of the body. And this is what probably happened to the child. He was probably picking and scratching at it, so that's why the lesion spread to other parts of the body. I would also encourage the mother to avoid sharing towels among siblings and among other family members, as this is why it probably spread as well to the younger sister. So no sharing towels, clothing, anything like that. And also avoid sharing baths. And so this concludes the end. Again, it usually resolves on its own and is not really recommended for treatment for children. It usually is recommended the treatment for immunocompromised patients, or maybe teenagers because of the appearance, or adults because they don't like how it looks. They could try like cryotherapy or other medications like benzoyl peroxide, but again under the supervision of a or they can be referred to dermatologists for other treatments that that need to be monitored because it can cause scarring. So this concludes the end of my presentation. Thank you.